Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Amanda Shackelford, who is a nurse practitioner at Family Practice Associates. Welcome.
Thank you, Dr. Fox, for having me. It's a pleasure.
All right, now with COVID, we got behind our mammograms, we got behind in our colonoscopies, but we're beginning to catch up. Last month, we talked about the importance of cholesterol because it's just one of those routine things. This month, we're going to talk about high blood pressure. So what is high blood pressure? What's the numbers that we ought to worry about?
You know, according to the American Heart Association, a normal blood pressure is less than 130/80. So when you start to get in the 130s, 140s, we're kind of a little worried. You know, obviously when you get in the 160s, 170s, 180s, that's more of a, oh wait, we need to do something now versus kind of let's do monetary changes. So, you know, less than 130/80 is where I like to aim for.
Okay, so why do you worry about it? Are there risk factors associated with it?
There are so many risk factors associated with high blood pressure. You've got both modifiable, which means things that we can change, and non-modifiable risk factors. For the modifiable, you know, obesity is a big risk factor. Weight definitely correlates with your blood pressure. We've got, you know, diabetes. It's hard on the kidneys. Kidney controls blood pressure, you know. Hyperlipidemia, you know, that plaque, it surrounds your arteries and it makes that pressure harder for that blood flow to go through. You know, sedentary lifestyles, getting no exercise in, you know, there's many risk factors. The non-modifiable ones, you know, things that we can't change, family history. If your mom has it, your dad has it, your grandparents have it, more than likely you may have it sometime down the line. You know, we see blood pressure the older we get. Most of the people I diagnose with blood pressures, they're in their late 40s, early 50s, 60s, first time they've ever been told they have high blood pressure. Sex plays a part. Males, you're at a higher risk for having high blood pressures. Then also race, you know, there's been several studies show that unfortunately African Americans are at a higher risk for high blood pressure. You know, and then of course, you know, smoking, drinking, all these things play a toll on your blood pressure.
So some of the things you can do something about.
Absolutely.
Sometimes though you have to take a medicine.
Absolutely, absolutely. You know, there's just some things that we can't change. We can't change our genetics, but we can definitely help lower these numbers.
Well, now when you talk about the numbers, is there a way to take your blood pressure? Absolutely.
The way you should take your blood pressure, you should be in a seated position, preferably a chair with a back. Both of your feet need to be flat on the floor. You need to get a blood pressure cuff that fits your arm. If the blood pressure cuff's too big, it could give you a false low blood pressure. If it's too tight, it's going to give you a higher blood pressure. So it needs to fit perfectly right around above your elbow, and it needs to be, you know, bare skin. There don't need to be several layers of clothes there. You need to hold your arm at heart level, and then obviously you don't need to talk while your blood pressure's being taken.
Okay, so if you get it checked, you just check it once and say, okay, that's my blood pressure, or do you have to do it over time?
Oh,
or
absolutely.
Does anxiety make a difference?
I mean, there's so many things that can make a difference. You know, the first time I see someone as a new patient, they could just be super nervous about coming in and seeing me. You know, what I have them do is I have them take their blood pressure for about 2 weeks and let me know what that average is. It's not going to be uncommon for one day your blood pressure to be like 140/90, the next day it'd be 117/84. I mean, it's going to do this. My key thing is, what is that average? You know, tell me what you're running over 2 weeks. If your average greater than that 130/80, I'm going to want to see you back in the office. You know, I'm going to want to talk about, you know, things that we can do to lower this blood pressure. You know, I want to check labs to make sure nothing is affecting, you know, causing these numbers to go up. But yeah, one reading is not going to be a diagnosis of, you know, hypertension. There's got to be several readings, and it has to be over a time period.
So you talk about blood pressure, you talk about what the numbers are. Why should we worry about it? What does blood pressure cause?
Yeah, there are many complications from uncontrolled blood pressure. You know, one of the major things, heart damage, you know, damage to your coronary arteries. You can have heart attacks. You can have congestive heart failure. You know, there can be an aortic dissection. There's plenty of things that can damage your heart from uncontrolled blood pressure. You know, big thing, stroke. I worked in the neuro ICU for 8 years. The #1 cause of those hemorrhagic strokes, uncontrolled blood pressure. You know, there's a few other things, you know, kidney damage. You know, if there's less blood flow to that kidney, it's not going to be able to do its job and filter throughout your body. You know, it can attack your eyes, you know, increase on the retina, decrease blood flow, vision loss. You got memory loss, decreased blood flow to the brain. You know, for males, there is a chance of erectile dysfunction. Again, decreased blood flow, and then the ability to achieve and maintain an erection. So there's plenty of complications from uncontrolled blood pressure. I know some people can just be like, oh, my number's just a little high, it's just a little blood pressure. But it really is a big deal.
Especially over long term, can lead to all those complications you just talked about.
Absolutely.
All right, real briefly, you talked about, you know, if you're obese, lose weight, exercise, stop smoking, take a medication. Touch a little bit on salt. Does it make a difference?
Yeah. Oh, salt makes a big difference. I mean, diet, you know, in general, you know, the greasy foods, the fatty foods, the salt, the more you intake, the higher that blood pressure is going to be. You probably should not be having more than, you know, half a teaspoon of salt a day, if that. I mean, I know, you know, some people like to, but definitely, you know, be mindful of what you're sprinkling on. Do some salt alternatives, but salt does a big play in high blood pressure. You know, there's many things that we can do besides starting a medication. Obviously, if we need to start a medication, we're going to start a medication. We want to keep you happy and healthy, right? But big things, you know, definitely, you know, healthy weight. Get a little exercise in. I know a lot of people are like, oh, I walk at work. No, that's not exercise. We need to do above and beyond our normal routine, you know, and then just a really good diet.
Well, we appreciate you coming in. We appreciate the care you give to the patients.
All right, thank you.
And if you haven't had your blood pressure checked in a while, get it done. It might save your life. We'll be right back.